Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome the Board of Directors for All Home Care Matters for a discussion on why is it hard for families to find the resources and support they need for their loved ones. Welcome Christopher of the Whole Care Network, Marianne Shuko of AlzAuthors, Roberta Carson of ZaggoCare, and Michelle Colucci. Thank you guys so much for being here. So today we are proud to announce that each of you are a part of the board here at All Home Care Matters, and our mission is to help families and their loved ones find the resources and support they need as they're dealing with long-term care issues. And that leads us to the topic of this discussion, which is how do families find the resources that they need when and before they need them? Marianne, I want to start with you because you're a part of a large organization, AlzAuthors, that is helping families through podcasting as well as resources and books revolving around Alzheimer's. What is the benefit of storytelling when it comes to dementia care?
Hi, Lance. Thanks so much for including me in this podcast episode. It's a very important topic. It's an important topic, and storytelling is very important for caregivers and others that are concerned about not only dementia, but other terminal or serious illnesses, because we can all learn a lot from each other. And many people are caregiving in isolation, or they may feel that they are the only one in this situation. And that can be really depressing and paralyzing in some cases. So when you reach out and learn from others, hear their stories, share information, your knowledge, that can give you more skills and more security and confidence in taking care of your loved one. So we recommend at AlzAuthors that caregivers dedicate even 15 minutes a day to trying to learn something new or to absorb somebody else's experience.
And we know how valuable that is, but for a viewer or listener who is maybe watching this right now or listening to it, who says, I barely have time to do my hair in the morning, how do I justify spending precious time reading books? What's the value to that?
That is the dilemma that we've uncovered. So when we started AlzAuthors back in 2015, there were 3 of us who had all been caregivers for parents with dementia and had written books about dementia and maybe about that experience. And we were all readers. That was our thing. Whenever we had an issue, problem, concern, something we needed to know more about, we went to books to find our answers. So we just naturally assumed it would be a great vehicle for other people. So that's kind of the impetus behind writing these books in the first place. But then as we moved along and grew and added more and more books and authors and stories to our collection, we really didn't get the response from caregivers that we had hoped for. We had thought that people would want to devour the information like we did. So we ended up developing our podcast and took what we had on our website and the information contained in the books and put them in an audio format. So that would allow people who are short on time to listen. And you can listen while you do something else. It's not like reading a book. When you read a book, you need to stop what you're doing and focus only on that activity. There's no multitasking if you're trying to read something and get something from it. So with a podcast like this podcast and many of the podcasts that Chris has in his network, you can listen while you do other mundane things like dishes or cleaning the house or driving or waiting for an appointment or any other activity before you go to bed at night to unwind for a few minutes, listen to a podcast, you could listen to an audio book. We have many of the books in our collection are in audio. So It's really a heavy lift for a lot of caregivers. And I know I was a caregiver and I knew that I spent a lot of my time running around like crazy, trying to put out little fires all the time. And there was always an interruption or a disruption and didn't always have that kind of like self-care time. But when I did take the time, I found that it helped make me a better caregiver. It was calming. It gave me information that I needed because we're not born knowing what it is that we have to do as caregivers. And most caregiving situations are thrust upon us with no preparation or warning. And I always say what everything you need to know about dementia care, you need to know on day one. And most people don't know anything.
Right.
So it's important to try to either find some time to listen to something or read something. You don't even have to read a whole book. You can just flip through the chapters and take what you can from what you see there that pertains to your situation.
Well, and to touch on that, everybody's situation is unique. You could be caring for a spouse, a parent, any number of different situations that involves dementia. How do people find the book that's right for them with AlzAuthors?
Well, AlzAuthors has made it really easy for caregivers to find relevant materials. So in our bookstore or on our website, AlzAuthors.com, you can find the categories that might fit your situation. So if you're caring for a mother, we have all the books that are about caring for your mom categorized in one section. So you can go there and you can either browse the titles, the book covers themselves and see what's there, or you can read the author's post. Every author has written a post for our website that's about their dementia story, why they chose to write their book, what the book means to them, how it can help a caregiver. All that information is included in the blog post. So you could kind of read through these blog posts and find something that might speak to you that you might say, gee, this person's story sounds a lot like mine. They confronted a lot of the issues that I am confronting, and maybe I should take the time to read this particular book rather than like going to Amazon and typing in dementia caregiving and getting 1 million hits. And then you quickly become lost, and whatever free time you had to look for something to help you is kind of squandered because you're not hitting on what you really need. So we have caring for a mother, caring for a father, caring for a spouse. That's a completely different situation. There are books for children. If you have children in your life that are impacted by your loved one's dementia, there are books for teens. We have caregiving guides, memoirs, fiction, nonfiction, poetry, photo books, and probably some other things that I can't think of right now. So we really do have something for everyone.
Well, and I think it's important too to make the distinction between looking for a book on AlzAuthors versus Amazon, because you don't always know the quality of the information you're going to get in that book on Amazon. What makes AlzAuthors different?
All of the books have been vetted by caregivers and authors. Everyone on our management team has a caregiving journey and has written a book about it. So we know what we're looking for when books come our way. Probably about 60% of the books that we review for the site are accepted. We don't accept every book. We have different reasons why a book may not be considered appropriate.
Right.
For example, we had one submission come our way, and very little of the book was even about Alzheimer's. It had a lot of more family history and things like that, which we didn't think would be interesting to our readers. So we declined to accept that book. Or they're poorly produced, poorly formatted, don't have good reviews, things like that. So we look at a lot of different factors when we consider a book. We look at the book's Amazon page because we're Amazon affiliates, and we see how many reviews do they have, what are the reviewers saying. It needs to be at least 3.5 stars or more. They need to have at least 5 to 10 positive reviews. We request a copy of the book, a physical copy from the author, and that is read and dissected by the acquisitions editor on that. We look at the author's social media platform and what they're doing to promote themselves and to promote their book, because it's a collaborative relationship where we'll promote your book, but you need to promote the rest of the books in the organization, promote AlzAuthors. So it goes through a very rigorous process. It takes several weeks. And then the wait to even get your book on our website at this moment is 4 months, but it can be as long as 6 months ahead. So
Wow.
it's very competitive. We have we're booked out into the new year. So there's a lot that goes into it. And we usually get really good feedback. I think just recently we had one negative feedback on a book. But that was rare, and it was probably just based on that person's opinion or personal preference,
Sure.
because you can't please everybody, right? You can't please all the people all the time. But we've really had a lot of success with that.
Wonderful. And we're going to come back to this after we do our introductions and everyone shares their companies and their organizations. But, we want to find out why it's difficult for families to find things like AlzAuthors or ZaggoCare or the Whole Care Network, and what's preventing them from doing so. So I want to start with Roberta here. How do you think patients and family caregivers can learn more about their condition and treatment options? And you're with ZaggoCare, so if you want to first start with sharing about ZaggoCare and the tremendous story and work that you're doing, Roberta.
Thank you, Lance. And as Marianne said, thank you for having us. And this is a great format for people who are patients or family caregivers to learn more. I started Zaggo, a nonprofit organization, to help patients and family caregivers be more empowered, engaged, effective members of their medical teams. And I started this after my experience for taking care of my son Zachary during a 27-month battle with a terminal brain tumor. He was 17 when he was diagnosed and 19 when he died. And the whole process was so overwhelming, not just having a child with a terminal illness, which of course is a tragedy that nobody wants to go through, but also what it took to be his family caregiver and to manage all of his medical needs and his appointments and his medications and therapies. And it was just completely overwhelming. So after he died, I decided to start a nonprofit. And I created a product called the ZaggoCare system to help patients and family caregivers more easily manage their own healthcare journey. So when you ask about what people can do when they have a diagnosis and how they can learn more, it's so important to understand, as Marianne said, nobody is prepared for this. Nobody is like, oh, next week when you get cancer, here's the 10 things you need to know. Or when you find out that your loved one has had a stroke, make sure you know this. So, you're completely overwhelmed. You can't even understand what the doctor's saying. They're using all sorts of medical terminology you never heard before. And it's really important that you educate yourself as much as possible. And one way to do that is online. And there's a lot of really good information online, but there's also a lot of fake medication information about fake treatments and fake diagnoses and things that don't work and that are unproven. So you do have to be careful when you're doing this research.
A lot of false hope and false information for sure.
Yeah. And a lot of people who are out there just to take your money. Right. Sad as it is, it's true. So if you do your homework, which you should, and you're diligent about it, you can find a lot of helpful information. There's a lot of government organizations. The US government has a lot of really helpful sites, Medline Plus, PubMed, a site called My Health Finder. You can use those. You can go to reputable large hospitals like Johns Hopkins and Mass General and the Mayo Clinic. They have a lot of information on their websites. And you can go to organizations whose goal is to help you understand your diagnosis and treatment. Things like Smart Patients and Choosing Wisely and Health Central and Cure Together. These are great organizations. And you can also look for the professional organization for your particular ailment. So if it's pancreatic cancer, you can look for the Pancreatic Cancer Network. So there's a lot of great stuff that you can get on a professional level from professional organizations, but you can also talk to other patients, similar to what Marianne was talking about with Alzheimer's. There's a great wealth of knowledge out there among people who have already experienced what you're launching into or are currently going through it themselves. So whether you find a Facebook group or you ask at your hospital or doctor for a support group, just talking to people who have been there, done that, you can learn a lot. Of course, take everything you hear with a grain of salt, but you can really find a lot of helpful information. And I know I just spewed through a lot of organizations, but if you go to our website, ZaggoCare.org, and you scroll down to the footer and hit the resources button, all of this information is available.
And you also have a tremendous award-winning blog as well on ZaggoCare, correct?
I do, thank you. Our blog is designed to give patients and family caregivers information they need on particular topics related to navigating the medical world. And they're research oriented, but broken down to be easy to understand information, and then tips on how to apply that information. So whether it's a blog on sepsis or medication errors in the hospital, or what to do about reducing your risk of infection, or whatever it is, you can search by topic. We have over 200 posts on the blog, and thousands and thousands of readers.
Wonderful. Roberta, why do you think it's when families are getting ready to bring a very sick loved one home from the hospital that they're not given a lot of these resources at that time, or even when they're leaving the hospital? What do you think it is that our healthcare system doesn't provide them with the support and resources of, finding things like AlzAuthors or finding the ZaggoCare support or the ZaggoCare system? Where do you think that breakdown is?
That's a really good question. I think it's multifaceted. I think that hospital staff are so overwhelmed, particularly now. They are short-staffed, they're very stressed, they don't have a lot of time to really sit down with somebody and do more than what is just absolutely necessary. I think there's hundreds and thousands of well-intentioned discharge planners and nurses at hospitals who want patients to have a successful transition to home, but they just don't have the time to do anything that's sort of above and beyond what's considered now like the normal amount of effort. And also, they don't know about Zaggo. They don't know about AlzAuthors. It's our job to educate them, in terms of discharge planning, and nurses who are helping patients and families get ready to transition to home or to, assisted living, wherever they might be going. I think it's a two-edged sword. I think it's the lack of time on their side, and also that they're not knowledgeable about everything that's out there.
But I think you're a prime example of why something like this is needed, because had you not gone through your experience with Zachary, there would be no ZaggoCare. And it's so true. Right. Yeah. And so you're trying to make that difference in helping families to have an easier, smoother transition into that caregiving and support role. Had it not been for ZaggoCare, who knows the families you've touched, and that you've benefited from. There's some wonderful testimonials on your website as well, showing what an impact, ZaggoCare has made. So, I mean, nothing but tremendous respect for you and the work you're doing at ZaggoCare.
Thank you.
You're welcome. So, Christopher, you kind of take it all and encompass it into one location with the Whole Care Network. Share with us what Whole Care Network is.
Well, the Whole Care Network is kind of an extension of my personal caregiving story, which was chronicled in 2015 in a Pulitzer Prize nominated caregiving story, In Sickness and Health, A Couple's Final Journey. The Whole Care Network, we believe it's through story sharing where diversity meets the road to collaborate on a common cause. And our common cause is supporting caregivers before, during, and after caregiving ends. And just like everybody else on the call has mentioned today, caregiving happens because of one or two things: an untimely diagnosis or an unfortunate accident. And suddenly you're thrust into this role with very little knowledge, very little skill, and usually you're in an emotional dither at the same time. You're trying to access information and referrals at a time where it's hard to make a pragmatic decision. And so what we've tried to do with the Whole Care Network is to break this down into story sharing, because we believe the best information and referral comes from those who have been in the trenches, those who have been down that path and understand the journey from a personal perspective. And I think what I've learned over the years now, I guess I've been in the space, goodness, 11 or 12 years. And this call today is a testament to this. There's no strangers when it comes to caregivers and caregiving. While we may not know each other personally per se, we understand where we've been. And there's that level of trust that's there right from the beginning, because no caregiver is going to purposely give another caregiver a bad referral. They're not knowingly going to give a caregiver a bad recommendation, because they understand what that would do. And then when you take it and personalize it in a podcast where you could hear the person's voice, and now we're trying to get into the big time and doing video like we're doing here, you have that sense of reality, that this person really knows what they're talking about because they've been there, and you connect with that person. Marianne had mentioned earlier about some like the books. Not everybody's going to connect to all the books, and not everybody's going to connect to all the podcasts that are available on the Whole Care Network. But you're going to find a podcast or a podcast host that will resonate with you. And I'm just assured that the information and the content that is delivered through the podcast are authentic, because not everybody. I wouldn't just accept any podcast on the network. You've got to have a story, and I need to know, what is your why? Why are you doing this? And this,
Right.
Personally, this kind of takes me back to my first job in social work in the mid '80s in St. Louis, when I was a director of an information and referral service hotline. This was before computers. We had a card Rolodex. We'd get calls anywhere from, what time is mass at the cathedral, to, I'm thinking about committing suicide. And you had to be on top of those resources. And that's what we've tried to create here at the Whole Care Network, is that resource-based, credible content that is from people that are in the trenches, that understand the journey.
Right. Chris, how do you think we can encourage people to be more proactive instead of reactive when it comes to their healthcare decisions?
Boy, that is the $64 million question, Lance. Is
Right.
How do we take something that is so critical? And here's an example. We're watching TV and we see all these commercials about whether that's Medicare or health. You're making your health decisions. How do we transfer that into action instead of reaction? I'd like to think that it's through listening to other people's stories, finding that way to have that conversation with your spouse or your parent or your grandparent, to be proactive, so that you know what that person wants when that time needs. Because when you have that little bit of knowledge when you're in the middle of a crisis, it makes an already emotional and difficult decision just a tad bit easier, but because you know what that person wants, and I'll use the generic term, what that care partner wants. Finding that combination to be able to have those proactive conversations, that's something that's been a goal of mine since I was honored to be a caregiver for my partner, Richard. We were lucky. We were able to have those discussions up front. And I just encourage people, as they can, to have those care conversations, be proactive instead of reactive.
And I couldn't agree more. What would you say are some of the key questions that these families and care partners and consumers, what are some of the key questions that they should be asking when they're searching for healthcare information and resources? Where does somebody start, and what are some of the key questions they should be asking?
I think, from my own personal experience, I remember typing in caregiving on a Google search and thinking back, this is 2011, and all just the plethora of information that came up. It's like all these new terms. What is it? Am I a caregiver? I think when you have the ability to kind of step back from the emotional component of what you're going through, and think about the people you know in your circle of friends, and just ask that question: Are you caring for somebody? Or you know somebody that's caring for somebody? What resources do you use? What questions are you asking? Because invariably, what you find out is that your best friend is probably taking care of their parents. They just don't talk about it. Or somebody at work, well, we can't talk about caregiving at work. That's taboo. But if you can reach out and just proudly say that you're a caregiver, you're going to find that those, not only the resources, you're going to find what works for other people and how they've gotten to the information.
Right.
And I think one of the key questions to ask any type of service provider that's in the care community per se is, what's your story? What's your why? Why are you doing this? Why are you involved in healthcare? Why are you involved in taking care of somebody else? Because that's gonna key you into their authenticity.
Exactly.
And I think and unfortunately, when you're thrown into the midst of a crisis with a loved one that is ill, or there's a terrible accident, you're not thinking about any of this. It's like, oh my God, I got to get all this done. And what usually happens when we're in an emotional drither and making decisions? We end up making poor decisions.
Right. Under pressure. Yeah.
Under pressure. But I know Mary Ann has heard me ask this before, and I say this in all kindness. Nobody has caregiving on their bucket list of things to do in life. Now, I've been told here recently that people have chosen to be caregivers because their spouse or partner has an illness or a handicap, and I commend those people. They're already on top of it. But for the most part, nobody plans this.
Right.
We plan trips to Europe. But we don't plan. We're not proactive in our care. And I think it's folks who have been in the trenches, by sharing those stories, even if you can help one person through a podcast or a book or what we're doing here today, then we've kind of accomplished what we're all called to do, is helping each other.
Exactly. Christopher, how would you say that we could provide some examples of assistance to new caregivers and care partners that doesn't come across as like you're trying to sell them something? Not a sales pitch, but an authentic way.
Well, that's another great question, Lance. And I think
I credit the author of the question.
Well, I wanted to give you some. I think the way to do that is simply to be yourself.
Yeah. And I think that comes across when a person's authentic. I think it comes across. Yeah, absolutely.
Yeah, you can tell when somebody's sharing their story, the authenticity behind it, because there's emotion.
Right. And how do we ensure our information and resources for these families and these caregivers and care partners? How do you ensure that it's up to date? And this kind of ties into ZaggoCare with Roberta and Mary Ann with AlzAuthors. things change daily. You know, there's new methods, there's new ideas, there's new approaches. It's something that you really have to stay on top of, or else you can be outdated by the next morning.
Exactly, and I think the magic combination to make that happen, Lance, is for providers to not work in silos. And one of the discouraging things that in this vast network, when I run across somebody that's in the network, the caregiving network, that doesn't want to collaborate, that doesn't want to share their resources.
Right.
There's an estimate of 53 million family caregivers in the United States today, and I think that number is low. I think if you're looking at this on the business side, I think there's enough business out there for everybody if you're just looking at it purely a business.
Right.
But if you really want to look at it as helping somebody, then share your resource and make sure that resource is up to date, because that is what at least I think what life is supposed to be about is sharing and helping other people.
Absolutely. I couldn't agree more. I mean, you know, we all have a common theme, and that is all we're trying to do is help get these resources and information in front of the people that need it. You know, and it's often said, you know, if you want to get rich, you go into a different profession that's a lot easier and a lot less stressful. And I see you nodding the heads. So, Christopher, last question for you. As providers, do you think it's appropriate and acceptable to be sharing those personal stories? And do you think that's something that should be done more?
I'm a big proponent of story sharing. I think that's what connects people in this network of caregiving and caregivers. Of course, not everybody is comfortable in sharing their story, and I certainly respect that. But as a provider and as a caregiver, there's a couple of things that happen when you share your story. It's cathartic for the story sharer, and then it demonstrates, and that we've used this word before, it demonstrates the authenticity. And it comes back to where I started out. It's, again, it's through story sharing where diversity meets the road to collaborate on a common cause. I love talking about our story because it reminds me I get to talk about my partner who's been gone now eight and a half years. And everything I do as it relates to the whole care network is in his memory.
Right.
And what I've learned throughout this experience, and I met Mary Ann through this experience, and I've met, look at the people I've met here, and because caregiving is the one social issue that I've come across where there's no boundaries. Everybody is impacted. There's no financial boundaries. There's no gender boundaries. There's no orientation boundaries. Caregiving brings people together from diverse backgrounds. And it's through that story sharing that allows us all to be better caregivers.
Absolutely. I think that's very well said. So I want to go to Michelle now. Mm-hmm. And Michelle's the one person who's not affiliated with organization, but she can speak, as to most of us, to the personal side of being in a situation of caring for a family member and a loved one. Michelle, you want to share your story?
Sure. Thank you, everyone, for doing what you do, because I am the perfect example of someone who desperately needed all of your resources. Like everyone has touched on, I was thrust into a situation in my, I was 42. My husband was diagnosed with pancreatic cancer that had already spread to his liver. And talk about overwhelmed. 12 years into our marriage, 2 little girls at home, and on our way to the appointment, and feeling so lost. And I'll tell you, just the ignorance of what even caregiving, I didn't even have the word caregiver to identify with. I was identifying as a wife and a mother, Yeah, so I definitely could have benefited from all of you.
So Michelle, why do you think it's hard for families then to find the care and the resources that they need when that time comes?
I mean, in my case, I think it was just ignorance.
Yeah.
I didn't know it existed. I'd never been through it. When you're younger, you think this is years and years away. I'd watched my mother take care of my grandmother with Alzheimer's, and I could have benefited from Marianne with that. Even not being the caregiver, it would have been great to read some of those books just as a part of the caregiving team that I guess we were. And I don't even think my mom necessarily identified as a caregiver, as a daughter taking care of her mother. Just not knowing the resources are out there, because this was 10 years ago. And if this was now and I knew this existed and I'd had my time in the field of caregiving, I would know, because during those sleepless nights when you can't focus on anything, it would have been great to turn on one of these podcasts and help navigate. And storytelling, and I'm going off the question, but what you guys all said about storytelling, yes, so needed. And I would have so benefited from other people's stories. And the perfect example of that is my mother had taken care of my father with cancer. And before our appointment, where, they'd already had the ultrasound, we already knew it wasn't going to be good. And before we went to the appointment, my mother called me and she said, now, I'm going to give you one piece of advice. You have to focus and listen to everything the doctor says, because he's not going to hear anything, meaning my husband. He's not going to hear anything past what they tell him, the diagnosis wise. And she was so right. He heard nothing. And I had to really force myself to focus, because the doctor's saying things like 6 months without treatment, a year with, and yeah, you have to focus and think, okay, what's next? And what does that mean? And what is he telling us? And the follow-up appointment and medications, and here's your options. And he heard none of it.
Well, I think part of the problem is when families are in that, patient room, if you will, and they do get that diagnosis, understandably, I think everything kind of shuts off and you're just focused on that last thing that you hear. And as difficult as it may seem, you need to be asking questions at that time.
Yes.
And that, for Michelle, I would say, what are the things that families should be asking at that moment? Because I think we can all agree in consensus that you're not being handed a folder full of resources and information for when you walk out the door. And so what would you recommend to families to ask when that time comes?
Gosh, I mean, that's a tough one,
right?
Because everybody's questions are going to be different. I would say, I wish the provider would have said, do you have any questions? It's more of just, here's your information, make your next appointment on your way out.
Right.
I don't remember anyone saying, can I answer any questions for you? Or maybe they, I don't know. Everyone's questions are different. Feel free to ask the questions, force the questions.
Right.
It's okay to ask the questions. I think sometimes when we're in doctor's offices, you get that white coat syndrome and you're overwhelmed and your world's been turned upside down and you don't think, oh, hold on, let me keep you in this room for another 10 minutes while I asked all these questions and they're coming so fast in your brain, you don't even know what to ask.
Well, Marianne, you're an author who happens to be a nurse, and I love that about you. What would you say is one of the obstacles, or where does that disconnect happen? Is that just the way it is, where families aren't getting those resources, or what's your perspective on that? Why do you think it's that way, at least for a majority? It may not be that way for everyone, but for, I would say, majority of the people, like Michelle's story, and I'm going to maybe speak for you, Roberta, if I'm wrong, please correct me. They're not given that support and those next steps to follow and those resources to go after once they get a terrible diagnosis. And that part is where I think the obstacle comes in for these families, which leads to a ZaggoCare's creation, a whole care network, Michelle's advocacy, and AlzAuthors creation. Why do you think there's that disconnect?
So many of the authors who have written books in our collection wrote the story that they wanted to read when they went through their journey. And many of the readers report to us that they wish they had had this when they were on their journey or earlier in their journey. So we know that people are craving information. I think a lot of it has to do with the way that our healthcare system is designed. Everything is based on profit, dollars, monies. Physicians have 10 minutes to spend, or 15 or 20, depending on the situation, to sit and speak with a family and explain something that is just, devastating and needs much more time to get information across. But the system doesn't let the doctor sit with you for 1 hour and answer your questions. It's not permitted. So a lot is lost because of that. And then when you exit from the doctor's office or whatever into maybe where you sign out or make your next appointment at the front desk, those people are not equipped to give you information, although that would be the perfect place. It would be the best place to have brochures, even like a sheet of paper to say, if it's an oncology office, with cancer care resources that would be given to you, not just out there for you to find on your own, something that would be handed to you to say, this might be helpful to you. Try to take a look at this stuff. You don't get anything like that. People, especially like with Alzheimer's disease, where there really isn't anything you can do about it. There's no treatment. There's no surgeries or drugs that's going to cure you. There's no cure. It's a terminal disease. It's very draining. Many of the concerns are deeply personal and can't be solved by the healthcare provider. And I think they just feel useless because they don't have anything they can give you, the magic pill or whatever. So a lot of that, they just send people out there on their own with nothing. I mean, even just to give them the information for the local Alzheimer's Association office would make a huge difference. But for some reason, it's just not being translated. So people don't even know from the very first day what kind of information exists out there, and most people don't have any experience with any of these diseases, most likely. I mean, you may have had a parent, if your parents have Alzheimer's or your grandparents have Alzheimer's, then there's a possibility you may have it too. So that might be a good be something you might want to look into, at least to know. But most people don't want to spend their time doing things like that. It's kind of depressing, it's sad, maybe unnecessary. Why do I need to be distressed?
And it will never happen to me.
It'll never happen to me, or if it does, I'll cross that bridge when I get there. But people need to understand that there are vast networks of organizations out there that have good information for you in regard to any illness, whether it's terminal illness or not. Now, I do want to say that when I worked in the hospital, I was a nurse. I worked there for 15 years. I was a case manager at the end of my years there. And we always gave people handouts on their disease process when they were discharged, along with their discharge instructions. And we had a system where we could just log in and print out, if they had, chronic obstructive pulmonary disease, emphysema, if it was a cancer, or anything. So we were able to give people that information at least upon departure. And we would make referrals for them as well. And one of the things we referred to is home care. And the home care agency and the home care nurse is a very good source for people to get information at that point. In the hospital, you're overwhelmed and rushed pretty much. And you don't feel good when you're in the hospital. That's like the other part of it, is that you're not at your best. You may be on medications that make your thinking cloudy. You're not really with it or there, and they get as quickly as they can. So you may not even be at your, 100% when you walk out the door, and they're trying to hand you information or give you information. You don't retain any of it. But then when you get into the comfort of your own home and start settling down, and a couple of days later, the visiting nurse might come to visit you, that person can be a very good source of information and should be able to provide the families with what's available to them locally organizations, associations, what's available online, what are the good resources, something that you know is going to be trustworthy and have good information. That would be a really great place if you're getting home care, because you may not, that might not be in your plan. So then again, you're like left floundering on your own,
Right.
and trying to discover, how am I going to figure this out? What do I need to know? And everything is so many things. It's like the whole medical piece. And then there's the caregiving piece and the financial piece and the support piece and the family piece and your demographics. And it just breaks down into all these little different layers that make up the whole caregiving journey that you kind of need to figure out. It's a good idea to know what's available in your community. Pay attention to what's going on. That's another benefit of story sharing. If you're hearing somebody else's story and they're telling you, we live in the same town and my mom has dementia and this is where we go and this is what we do. Now you know that exists. That's available to you in your community.
Well, especially for seniors. And I was just going to say real quickly, especially for seniors, the senior centers are a wealth of information. I know most of the senior centers in our communities, they have walls of resources for the seniors when they come in and, investigate there. If you live in a city that has a senior center, and hopefully you do, that's free. Go in and, take advantage of it. And I know I'm looking at Roberta and I'm just thinking to when, you got your diagnosis with Zachary, it led you to start a huge nonprofit in this whole ZaggoCare system because it was something you needed that wasn't available at the time. Did you have an experience, Roberta, where, like so many others, you weren't given the resources and the help at the time, or was it different for you?
The whole thing was that experience. I mean, actually interesting listening to everybody talking about what you are and aren't given upon a big diagnosis or a scary event in your life. When Zachary was first diagnosed, the very first day they gave us a binder to take home. I've never seen such a thing in my life. It was at least 3, if not 4 inches thick. I was so overwhelmed. I put it in a closet. And when he died, I took it out and threw it away. I never looked at it because it was just too much and too scary. But there were so many times that we said to ourselves, my husband and I, how come we didn't figure this out sooner? Or how come nobody told us this? And even very simple things. So at the end of Zachary's life, he had a fatty deposit of tissue in his spine from high doses of steroids and became paralyzed. And it happened fairly quickly. Like he first fell while walking in March or April. And by July, he couldn't walk, talk, swallow, just completely paralyzed. And we're trying our best to take care of him. And he was getting chemo infusions once a week. So I brought him in. And yes, Zach was a child, a teenager, but he was 6'5" and weighed 210 pounds. So he was a large man-sized person. And so even though we were in a pediatric clinic, here I come in with this large male and I'm wheeling him in a wheelchair and everybody sees that. And I can't get him from the wheelchair to the bed where he's going to have the infusion. So I have to ask aid, can you help me, get him into the bed? This is going on for weeks. I mean, everybody there knows that he's completely paralyzed. And finally, a nurse says to us, oh, by the way, where's Zach sleeping? And I say, oh, well, he sleeps on the sofa in the den and we sleep on the floor next to him because we can't get him up the stairs. It's not like a 3-year-old, you just pick them up and carry them to their bedroom. And the nurse says to me, why don't you have a hospital bed? And I was just so taken aback. I was like, because I never thought of it, because my child, in my case, was so sick. It was all I could do minute to minute to try to keep him alive. I couldn't step back and see the bigger picture and see what help we might need. Yet week after week after week, nobody thought to mention this to us. Like, do you have a lift? Do you have a hospital bed? What kind of equipment do you need? And I feel so stupid that we didn't think of it, and we got one within days. We're like, oh, what a great idea. What, like, such a epiphany, which something that should have been so obvious. But there were many situations like that where we weren't told about resources or told about information that would help us. And we had great care, and I'm very attached to the hospital where Zachary received his care. So there's no hard feelings. I raise money for them. All 100% of the profits from the sales of ZaggoCare systems go to a brain tumor research fund in Zachary's name at this hospital. So there's no feelings of ill will, but we were on our own from day one. Just nobody sits you down and says, here's what's going to happen. Here's what you need to know. Here's what you need to do. Here's what you need to get. Here's what you need to learn how to do. It's really overwhelming.
Yeah.
Lance, I think part of the issue too is that we really don't know what the outcome is going to be. We may have some idea. We certainly don't want to talk about a negative outcome,
Right.
especially the healthcare provider, to parents of a teenager that, you're going to lose your son. I mean, they try to avoid saying something like that. They
Yeah.
try to make you think that you can, they told you that it was terminal?
Oh yeah. From
From
day
day
one,
one?
they told us that he had 4 to 6 weeks to live
Oh my.
with no treatment and months to live with treatment. No, I mean, maybe in other circumstances you don't hear this harsh news, but 100% of cases of DIPG, which is the brain tumor that Zachary had, are fatal. So there's no sugar coating it. They told us there was a less than 5% chance of survival, but actually it's less than 2%. And even that 2%, some of the people in the medical community dispute whether or not it was a true DIPG or some other kind of brain tumor. So we heard everything from day one, and actually much to our disappointment and anger, actually, Zachary was in those first meetings and heard that right away, that he was going to die. And I would have cushioned that a little better for him. I wouldn't have told him the very first day when he's trying to digest this, like, oh, by the way, you're going to die. But I think the fact that he was 17 at the time and tall and big and seemed more adult-like than he was, I doubt they would say that in front of a 6-year-old.
Right. Michelle, did you have something you want to add to that?
I was just same thing. They had no trouble telling us within 2 minutes of meeting the cancer doctor that 6 months to live with no treatment and a year with. They had no trouble telling us that.
Wow.
So in dementia world, I don't think that, there's no way to foresee the prognosis. And we have many people who didn't even know that it was a terminal illness. And the other flip side is that this could end in a matter of months, or it could go on for decades. And people are not prepared for 20 years of caregiving somebody with progressive brain disease.
Right.
So, these are two totally different cases.
Christopher, how was your situation different than Michelle's or Roberta's?
Well, when Richard was diagnosed with esophageal cancer, I had taken the doctor aside and asked him,
Okay.
what are we looking at here? And he said to me 3 to 4 months. And I took that information and I made a decision based on my knowledge of Richard and his personality. And I decided not to tell him right off the bat. I wanted to see how he was going to do over the next 4 to 6 weeks, because I knew him better than the doctors did. I knew his personality. I knew his abilities. And he lived another 29 months from that original diagnosis. And about a year after that, from that diagnosis, I told them, and we were actually on a podcast together, and said, you were given 3 to 4 months to live. And he repeated to me, and it's one of these special memories that you have through story sharing. Said, I'm glad you didn't tell me, because I probably would not have thought as
Yeah.
I did. Because the fact of the matter is they really don't know. And this is where the personal knowledge and understanding of the caregiver really comes in handy, because your care partner, your loved one, however word you want to do, them better than any physician, any nurse, anybody on the care team. I use a business term, you're the CEO of their care, the chief everything officer. So, when you make those decisions, be mindful that you're doing it from strength, from knowledge, and be okay from that. Challenge authority, challenge the decision makers. Be comfortable in knowing that any information you have about your care partner is critical in order for them to make the decisions they need to make. But be collaborative. Again, Richard and I were fortunate we were able to talk openly about his care. I knew exactly what he wanted up to the day he died. And it's so important to be able to find that comfort zone when you're dealing with your care partner and your care team.
Right. Did you think, and I was just, as you were talking, Christopher, I'm wondering, in hindsight, do you feel like your background and education as a social worker helped you in any way during your care partner journey with him?
I think so, Lance. I was used to dealing in the system per se,
Mm-hmm.
but I also have to say, when it's one thing when you're helping somebody else, but it's another thing when it's you and your person that you love and care for. It puts that it puts that emotional component to it. And to give you an example, we would get 300 to 400 calls a day at Catholic Charities about help, and we give the best. I give the best information I possibly could. But when the day ended, I wasn't emotionally attached to that. This is different. There's an emotional component to this that is very difficult to measure and very difficult to explain. So, for me, I was grateful that I had the experience, but I also knew that, with being emotionally involved in it, I really had to find somebody that I could talk to that could help me with my emotions. Yeah. Because, there's two very common aspects to caregiving. There's a beginning and there's an end. And we're not prepared for either one of these life-changing events. Right. And then that's where that emotion comes in that is often left unchecked because you just don't know where it's going to lead you.
Yeah. There's no map, that's for sure.
No map.
Well, I want to thank all of you for taking the time out this morning to share your personal stories, your experiences, and the tremendous work that you are all doing at AlzAuthors, the ZaggoCare system, as well as the Whole Care Network, and for Michelle, and for being a part of the board here at All Home Care Matters. We're looking forward to continuing to do great work helping these families. And, like Christopher said earlier, even if it helps just one person, we're doing the job. And that's the important thing, is helping as many as we can. So thank you all so much for your time, and we look forward to talking to you again next time.
Thank you.
Very
Absolutely.
good.
Thank you so much.
You're welcome. Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. We'd also like to say thank you to the All Home Care Matters Board of Directors for the discussion today on why it's hard for families to find the resources and support they need for their loved ones. We look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.